Hello, everyone, and thank you for attending the Memorial Health Virtual Job Fair event. I would like to introduce you to Megan. Megan will tell you about their company, job openings, and how to apply for those openings. Megan?
Hi, so as mentioned, I'm Megan Nelson. I'm the sourcing manager with the recruitment team here at Memorial. Wanted to talk you through a little bit about the organization first and foremost. So as you can read in our description, we are one of the leading healthcare organizations in Illinois. Now, some of the important things to know, our team does do all of the recruitment for all Memorial Health System locations. So that is 5 hospitals. That's Memorial Medical Center in Springfield, Decatur Memorial Hospital in Decatur, Passavant Area Hospital in Jacksonville, Taylorville Memorial Hospital in Taylorville, and Abraham Lincoln Memorial Hospital in Lincoln. We do also do all the recruitment for Memorial Physician Services, so our clinic locations. We have several clinics throughout Springfield. We have clinics in Chatham. We have a clinic in Petersburg, a clinic in Lincoln. We also have our express care locations that we recruit for. We have our home health or our home services, so home health and hospice, as well as the commercial kind of medical equipment side of things. And then we do have our behavioral health branch as well. So lots of different kind of parts and pieces that keep the hospital moving. Our group recruits for everything except physicians. The physicians are handled kind of separately by a different group of people. So what that means is we have positions in a wide variety of areas. I frequently hear from folks that, oh, I didn't know you hired, accountants or things like that. I thought the hospital was just looking for nurses. Yes, we are always looking for nurses. We are always looking for clinical staff, but we do have positions ranging from housekeeping to food services to front desk kind of patient service folks. Right now, I know we have an accountant opening. Like I said, lots and lots of different things for lots of different folks with lots of different backgrounds. Right now, our system as a whole sits at about 10,000 colleagues. And that's just the employed folks. Outside of that, we've got partnering physicians, we've got hundreds and hundreds of volunteers, and we've been working to serve our community since 1897. Big positions that we're trying to focus on right now, or that we'd really like to put a focus on, are in our environmental services, foods, and security areas. We do also have patient safety monitor positions that are a very critical need for us, particularly in the age of COVID-19. Things that are exciting about being an employee at Memorial or a colleague at Memorial. One of our 5 goals as an organization, we say that we have the 5 greats. There are 5 great goals. One of them is to be a great place to work. And I think that says a lot about an organization when one of your top 5 strategic goals across the system is to be a great place to work. We strive to be supportive of our employees in a variety of different ways, whether that's from our comprehensive benefits packages or fair compensation to educational reimbursements, internal education programs, things we can do to help facilitate your career growth throughout the organization. We very much strive to be supportive in that sense. As far as the hiring process is pretty standard for all of our affiliates. Again, we do all of the recruitment for all of those organizations through this one recruitment office. So in order to apply for any of those positions, you can just visit jobs.choosememorial.org. When you're on that homepage, you'll see a nice button that says work with us. You can enter any key terms there, or you can just click that button and it'll bring you right to our search page. From there, you can search for positions by location. If there's a particular city you'd like to work in, you can search for positions by type, so by category. Maybe you're looking for nursing positions versus a clerical position, or something in support services. You can also search by position type, meaning full-time, part-time, or per diem, so that you really can kind of right off the bat see what we have that meets your needs. When you find a position, it's simple enough. You'll click the Apply Now button. It'll bring you into our applicant tracking system to fill out a brief application or upload your resume. Once you have uploaded your resume or filled out the application, it takes our recruiters a couple of days to review the applications. We try to get back to you within 3 business days. We do review all applications. A recruiter reviews all applications. There's no machine doing it. It is human eyes reviewing all of your applications. Next step after if we were to move forward with an application is typically filling out a reference survey, entering the information for some folks you've worked for in the past to help us get a better sense for your work history. From there, we would move through phone interviews with recruiters and onto manager interviews. Now, in the days before COVID, we would do on-site in-person manager interviews. Now, in the age where that's not necessarily a safe or effective practice, we are doing video interviews with our hiring managers. So that is something that we help you set up. We make sure we've got all the technology in place to get that interview taken care of. And then, from there, that would be the last step in the process. We'd move forward to extending an offer or getting you onboarded to the organization if that's the route we chose to go. I think those were the big high points that I was really hoping to cover. So are there questions?
Thank you for your presentation, Megan. I'm just going to go ahead and ask you some standard questions. Have a little bit of time to go ahead and do so?
Yeah.
Excellent. So you kind of just gave a brief overview of the hiring process.
Yep.
Can you just kind of give folks out there tuning in today a generalized idea of how long the process typically takes from the point of submitting an application to the point of actually being hired?
Yeah, we try to move through each stage of the process within 3 business days. So from point of application through the end of the process, we would love for it to take under 2 weeks. Now, the only caveats to that are things like hiring manager availability. We do need our hiring managers to be able to interview you, and there's a lot going on in the hospital. Or candidate availability. Maybe you're working a full-time job. We've got to find some time for you to come on in for that or to get on video for that interview. Those typically kind of are the caveats to that, but we really like our process to be 2 to 3 weeks.
Thank you, Megan. And I'm sure as you are aware with things going on, given the atmosphere environment that you work in, can you kind of just elaborate a little bit more on how the hospital is handling COVID safety precautions?
Yeah, so when we are on site or working in our offices or floors or what have you in the organization, everybody is wearing the correct PPE. So for non-patient facing positions like mine, we would wear masks anytime that we are not isolated in our offices. So for this moment in time, I am not wearing a mask. I am in my office by myself. If I were to enter the hallway or go anywhere else, it is required that I wear a mask. For some of our patient-facing positions, your PPE, your protective equipment would be different. You might be required to wear goggles. You might be required to wear face shields. It's kind of dependent on the position and the level of contact that you would have. Outside of that, each employee is screened every day. You answer a series of screening questions about symptoms, anyone in your home that might be experiencing symptoms or have tested positive, and submit your temperature as well, your temperature for that day. We do have processes in place if someone in your home were to test positive, what that would mean for you as an employee to avoid potential spread. We have processes in place for if you are feeling some symptoms but aren't sure, maybe it's seasonal allergies or different things. We've got our colleague health department handling those calls and triaging those things on a daily basis to make sure we're doing what's right for everybody involved. We are really also trying to limit contact and social distance wherever we can. So even things like in the cafeteria, all of the tables are spread out. We've got different markers in the cafeteria for when you're waiting in line, where to stand. We have, when we're having meetings now, if you're in a non-clinical role, those are done virtually. We've got virtual software to do that. Or even like I mentioned, our interviews are now video interviews. So like I said, really anything and everything we can do to keep you safe. To keep our colleagues safe. And then obviously we encourage the washing of hands, use of hand sanitizer, and all those other personal practices to keep each other safe.
Excellent, thank you, Megan. And for any of the positions that you referenced here today, are any of those that are available able to be worked remotely?
The environmental services, food services, security, and patient safety monitors that I mentioned would not be remote. Those would be on site in our organizations. We do have positions that would work remotely. I think our accounting positions might be, that's something that would be up to, the leader and the candidate, something they could discuss. Anything that we have that is non-patient facing, that can be a discussion around remote work that would work for you as the candidate and for the hiring manager and the team.
Thank you. And do all employees need to have a GED or high school diploma, to be able to apply for work within your organization?
No, we do have positions that do not require that. Even like in our foods area, we have students that are still in high school that take those positions or that work in some of those positions. So we do have positions that do not require that, but I will say that the majority of them do.
Excellent, thank you. And for some of the positions that you referenced here, can you just kind of give insight into what a typical day might look like for folks that would be interested in applying?
Yeah, so I think especially when we talk about environmental services and food services, one of the really underplayed portions of those positions are the impact that you have on a patient's stay. So if you think about it, right, you're in the hospital or maybe you've got a family member in the hospital, every interaction that they have with an employee is important to their stay. These people might be scared, they're not feeling well. When you're in the hospital, you're not having the best day of your life, you're just not. So we're really looking for people that understand that and can be friendly and supportive and really help provide that great patient experience. Every day is going to be a little bit different. I think that's one of the big pluses of working in a hospital is that there are no 2 days that are the same. It is all really dependent on who's here and what you're working on and what kind of patients you're dealing with. When we're talking about environmental services, you would typically be assigned to a specific section of the organization. So maybe a particular floor, a particular department, particular unit, and you would be doing the cleaning on those units. So things like emptying trash and cleaning the floors and entering patient rooms and cleaning patient rooms, entering offices and cleaning those. So again, those interactions where it's really important to help provide those smiles and that great patient experience that we strive for. In our food services area, we have a variety of roles, anything from, we've got some grill cook positions where you would actually be, preparing food both for patients and for staff. We have some food service utility positions, so they kind of float around to different areas within food service. So you might be working as a cashier one day, you might be running food to a room on another day. And then we have some call center associate roles. So those are typically the people taking orders from hospital rooms. So you'll be interacting with patients over the phone. You'll be working with dietary restrictions that patients might have. Maybe a patient's on a liquid diet or a low sodium diet, things like that. And it's kind of up to you to help work with them to order items that meet their needs. Yeah, I think those are kind of like I said, no 2 days are the same. And we've got a lot of different things going on in the organization.
Thank you, Megan. And can you kind of elaborate a little bit more on what some of the standard benefits somebody might be expected to receive or be offered if they got the job? And then also, kind of piggybacking off of that question, can you elaborate on if your organization offers any sort of fringe benefits?
Got it. Okay. So from our standard benefits, we do have two different health plans. We've got a kind of a standard premium plan and what we call a consumer-driven health plan. We typically can share rates and really detailed information about those at the time of a manager interview. Now, the important thing with both of those plans is that we also have the Memorial Choice program. So what that means is, as a Memorial colleague, if you were to go to a Memorial physician for your general physician and you went in for an office visit, there would be no charge for that office visit. Or there's a set of labs, very specific routine labs that there is no charge for if you're using Memorial physicians and Memorial lab services. So it really is a great way to not only engage with our health system as a Memorial colleague, but it really does save you money in the long run to have that Memorial Choice program. We also have a vision program that is optional to sign up for. We've got a dental program that's optional to sign up for. You can put money into a 401k program. And then we do have some additional benefits that the colleague can choose, so kind of our extra packages, if you will, things like hospital indemnity coverage, accident coverage, critical illness, we've got whole life, there are even some adoption-related benefits.
Excellent. And do you provide any sort of like clothing allowances? That's a question that I receive quite frequently.
Not to my knowledge, but we do in certain areas where there are very specific scrubs required, things like the operating room, those are provided.
And another question that I get frequently is, are there any sort of restrictions on tattoos, hair coloring, or piercings to work with your organization?
Really what we say is that we want you to have a professional appearance. And again, you got to think about it from a patient's standpoint, right? We want anyone who works in this organization needs to be presentable, from a patient perspective. We don't have specific requirements around tattoos or piercings or hair color or anything like that.
And are there any sort of particular shifts that you are kind of emphasizing as far as wanting to get folks hired on for?
I would say, especially with a lot of our positions that are currently open, we have a lot on evening and nights. Again, we're a 24-hour operation. So unlike maybe a retail organization or a clinic that's just 8 to 5, we are here 24/7, 365. So we do typically have a lot of evening and night shift openings.
And how is your overtime pay structured? At what point is that triggered?
Overtime would be triggered after 40 hours a week, so 80 hours in a pay period. We have 2-week pay periods here. Um, I honestly cannot remember the percentage off the top of my head. I want to say it's time and a half, but I honestly cannot remember. That would be something I would need to look up for you.
No worries. Thank you, Megan. Another question that I like to ask is, can you kind of describe what the opportunities for advancement would be within your organization? And then in your own particular case, are there any sort of success stories that you can reference, perhaps even your own?
Mhm. Yeah, great question. We as an organization really like to support the growth of our employees through the organization, right? So we do have tuition reimbursement programs you can apply for. We have certification reimbursement programs, depending on what you're trying to accomplish. So we've got a couple different stories we like to reference. My story particularly, I actually got a recruitment certification to help me be better at this job that the organization did reimburse me for. So I did use that certification reimbursement. We have a lot of folks that have started maybe in foods or housekeeping and are now in nursing roles. One of my favorites, we have a nurse manager who started in our TENS camp that we used to have. It was a teen nursing camp. She started in that, then she was a nursing intern, then she was a patient care tech, so a CNA, then she was a nurse, and now she's a nurse manager on one of our floors. Our CEO actually started as a floor nurse, which I think is a really great one to talk about. So he went from, being a nurse on a unit to a nurse manager, moved through the ranks to be the CEO. Even my boss, the director of talent acquisition, she started in medical records, just kind of scanning and entering medical records, and has moved throughout the organization and is now the director of talent acquisition. So there's a lot of different ways that we like to support and watch our employees grow.
Fantastic. Thank you, Megan. And I do have just kind of a final question for you, for the folks that are out there listening.
Mhm.
Can you kind of describe how a candidate might be able to stand out and get an interview, assuming they are qualified for the position that they are applying for?
Yeah, I will say, when you're submitting applications, pay attention to the details in your application. Um, as recruiters, we get a lot of applications. We see a lot of people, and we really need things on your application to be very clear and understandable. So we tell people when you're inputting your work history, make sure you do it in a chronological order so that we can really walk through what your work experience is and get a good feel for your background. Make sure that you put some information in the job duty section so that we don't have to necessarily guess what your experience was. Sometimes a job title doesn't cover everything that you've done. And if we're trying to figure out, is your experience a match, that's a great way for us to tell. Pay attention to things like spelling and capitalization. If we have a lot of candidates, it's little things that stand out in both a good and bad way sometimes. So I would just say pay attention to the details, make sure you read all the directions on the application and follow them. And I would say be responsive. I know there's a lot of communication, a lot of people get a lot of emails, but if you're searching for a job, we would, expect you to answer and be responsive. One of the things I tell people is to check your junk folder and your spam folder. A lot of organizations use applicant tracking systems, and sometimes those emails are flagged as promotions or as spam. So especially if you're actively applying, make sure you check those folders for emails from your employer or potential employer.
Thank you for that, Megan.
Mhm.
And for folks that might have any sort of general inquiries or questions for you about any of the positions that you referenced here today, where would you guide them to go ahead and get those questions answered? Do you want them to follow up directly with you? And if so, what would be the best means of getting in contact with you?
So actually, I would say the best thing to do, we have a generic careers email address that our whole team has access to. So it means that there's multiple people checking it all the time. You're not just relying on me and my schedule. So you can email careers@memorial. So that's CAREERSAT memorial @MHSIL.com. I know it's a little confusing to spell out the at and have the at sign, but that careers@memorial@MHSIL.com is the best way to reach out to us with questions.
Excellent. Thank you, Megan. And at this point, I think we can go ahead and wrap up today's session. Is there any sort of summary statements or information that perhaps you might have overlooked that you'd like to include?
I think it's just important to say that, I mean, I've worked here, it'll be 6 years next week, and I have loved every minute of it. I think Memorial is a fantastic employer, and we're looking for fantastic colleagues to join our ranks.
Thank you, Megan. And again, I want to thank everyone again for attending this virtual job fair. You can find Memorial Health's employer booth on the Illinois WorkNet virtual job fair page. I have also recorded today's session, and that recording will actually be posted to the Illinois WorkNet YouTube page, so you can view this session there later today. That recording will also be posted on Memorial Health's employer booth web page. So if there's any sort of information that you'd like to reference there, or anything that you would like to see from the presentation today, you can go ahead and access that recording at that location. Thank you everyone for attending. Megan, if you could stay on for one moment after this, that would be fantastic.
Absolutely.
Thank you.